We all know the image, right? Florence Nightingale, the lady with the lamp. But what if I told you her most powerful tool wasn't the lamp she carried, but the data she collected? This is the story of how statistics, not just sympathy, completely transform the way we care for people.
Let's just start with this quote from Nightingale herself, because it's pretty wild. In 1863, she wrote that the first rule of a hospital should be to do no harm. I mean, the fact that she even had to say that tells you something terrifying about healthcare back then. Hospitals weren't always places of healing. A lot of the time, they were death traps.
So the story most of us know, it starts in the darkness of the Crimean War. We have this iconic image in our heads of the lady with the lamp, walking the wards alone at night, bringing comfort to wounded soldiers. She's this symbol of compassion, a legend born in the middle of a really brutal conflict.
But her journey started way before that. Born in 1820, Nightingale wasn't just kind. She had a seriously sharp, analytical mind and a real talent for math. As a teenager, she read a book on statistics that just lit a fire in her. So when the Crimean War kicked off in '53 and these horrifying reports started coming back, she was kind of uniquely prepared. In 1854, she led a team of nurses right into the heart of the crisis.
And what she found in Scutari was, well, it was a nightmare. It was worse than anything the papers were reporting. The hospitals were just pure chaos. Soldiers were dying left and right, not so much from their battle wounds, but from diseases like cholera and typhus that were just spreading like wildfire through the filthy, overcrowded wards.
So the big question is, how did one person manage to turn all this around? The legend says it was her constant nursing, her compassion. And look, that was absolutely part of it. But her real secret weapon, it wasn't the lamp she carried. It was something way more radical for the time.
And this, right here, is where the story gets really, really interesting. The lady with the lamp was, deep down, a passionate statistician. She just got it. She knew that if you want to solve a problem, you have to measure it first.
Yep, that was her weapon of choice, data. She started recording everything, mortality rates, the causes of death, the conditions in the hospital. She knew that numbers could tell a story that was way more powerful than just words.
This quote just says it all, doesn't it? And she developed this whole philosophy working with the amazing statistician William Farr. For Nightingale, data wasn't some passive thing, just a record of tragedy. It was a tool for action. Her goal wasn't to report on the deaths. It was to stop them from happening in the first place.
Okay, but let's be honest, tables full of numbers can put just about anyone to sleep. To get the government and the public to really grasp the scale of the disaster, she had to make them see it. And this need led to her greatest innovation.
Her big idea was actually inspired by this chart from her collaborator, William Farr. He'd used this new kind of radial design to show the relationship between cholera deaths and temperature. Nightingale saw it and immediately knew this visual style had huge potential for telling her own story.
So, her first try, sometimes called the batwing diagram, copied Farr's design. It used a linear scale, so the length of each wedge showed the number of deaths. But she realized right away there was a huge problem. It was deceptive. See, our eyes perceive area more than length, so if deaths doubled, the wedge looked 4 times bigger. The visual was actually distorting the truth she was trying so hard to show.
So she made this brilliant tweak. She completely redesigned the chart so that the area of each wedge, not how long it was, represented the number of deaths. It's a subtle change, but it was profound. It made the whole thing accurate and incredibly persuasive. This became her famous rose diagram, a masterpiece of data visualization.
And what did this new diagram show? Well, the message was just impossible to ignore. It was shocking. The huge blue areas on the chart, those were deaths from preventable diseases. And the tiny little red slivers near the center, those were the deaths from actual battle wounds. The soldiers weren't being killed by the enemy, they were being killed by their own hospitals.
So now she's armed with this killer chart, this undeniable proof. And she didn't just go ask for more nurses or better supplies. No, she set out to heal the entire system of healthcare, both military and public.
She put all of her data, her diagrams, and her conclusions into her 1863 book, Notes on Hospitals. And this wasn't just some report. It was a blueprint, a battle plan for a revolution in public health that would spread her ideas everywhere.
Her key principles sound like complete common sense to us today, which, honestly, just proves how successful she was. She was fighting for things like clean air from good ventilation, clean water, proper drainage, cleanliness, and lots of light. This wasn't just about tidying up. It was one of the first real examples of evidence-based practice. She proved that a clean environment was a medical necessity.
And she didn't just stop at writing about it. She started drawing.
Her book included detailed architectural plans for new hospitals, designed to maximize airflow and light and to keep patients separate to stop infections from spreading. She was literally redesigning the buildings where healing took place, building her data-driven ideas into their very foundations. So when you step back and look at the whole picture, The Lady with the Lamp is really just the first chapter of a much bigger, much more incredible story. Her real legacy is so much more complex, and we're still reinterpreting it today.
Today, we see her in so many different ways. Of course, she's still the legendary figure, the icon of nursing, but she's also seen as a feminist hero who just smashed through Victorian expectations. She's a dedicated statistician, a true pioneer in making data visual, a public health innovator who designed modern hospital standards, and, let's be real, she was a pivotal contributor to STEM, applying science and tech to save lives.
So in the end, it really all boils down to this. Florence Nightingale didn't just care for sick soldiers. She used her brilliant mind, her math, and her incredible determination to diagnose and heal an entire sick system.
And that kind of leaves us with a final thought, doesn't it? Her story just shows the incredible power of visualizing data to expose a hidden truth and force change. It really makes you wonder, what problems in our own world today are just waiting for their own radiant diagram to finally bring them into the light?